Welcome back, everybody. It's the group. Well, what do we call? What do we call it?
I don't know. It's been
It's
a day. It's been a very Monday, like Tuesday today.
It has been a crazy day. But in
She
honor,
Speaks. That's what we call
She
it.
Speaks. That's right. Welcome back to another installment of She Speaks. I almost said Wellness for Women. That's what I was going to say. So, there's your plug.
There's your shout out.
She Speaks. And in honor of Breast Cancer Awareness Month, which is the month of October, we are going to be tackling a very tough and so many different ways subject, but I also think it's something that is good to have a conversation
Because
around.
it's not all just about pink.
It's not, and not just, it is Breast Cancer Awareness Month, but this applies to all types of cancer and treatment, because we want to talk about how to recover after treatment and what that looks like, not just physically but mentally and emotionally.
Absolutely.
And then how to get your spark back, because it can be such a life-changing experience that you have a new normal. So that's what we're going to be discussing tonight. So as always, if you have any questions, feel free to drop them in the comments and we will get to them as you send them to us. So where do we want to start?
Why don't you
That's a
introduce
heavy
yourself?
topic.
Oh, yeah.
Yes, we could.
Hi, good evening. I'm the most nervous probably on this whole thing, so because I want to get this right, and this really touches me, and I am honored to be here with women who take care of women. Predominantly, our customers are women. So I've never had cancer or breast cancer, so my disclaimer is I've learned through the lived experience of family, loved ones, friends, and clients. And so I'm humble and honored and took notes that spoke to me because I had a lot to say.
I love it.
You might see me reference my notes, but
And
that's me.
Just clarify what you do.
Oh,
Your
I'm a mental
profession.
health therapist.
She's a random person who stopped in for the night.
Yes, I just came to visit the skeleton in the building.
She came to visit Cletus.
No,
But
you
yes.
got cred.
Yes.
You got some initials. It's all good.
So licensed clinical social worker that has the honor to be with this group part-time, mostly working with women, but I also am the spouse of a first responder, a mom, and my full-time job, I serve people exposed to high-risk, high-stress event. And I can't think of anything more stressful than getting a diagnosis and living through the treatment of a diagnosis and caring for all the responsibilities that many of us have, in addition to fighting for our health. So
True. So true.
Hey, checking back in. I am Maribeth Loynes, owner, physician, wellness for women. I obviously do mostly female health care, so breast cancer is near and dear to my heart for that reason, but for others as well. If Kim is the most nervous on this panel tonight, I am probably the most cynical when it comes to breast cancer, because I actually had a diagnosis of breast cancer, and so I know what it is to hear those words and then live the life afterwards.
wow.
And I live most every day trying to put a positive spin on that, because it's hard, but not impossible. And if done with care and purpose and good support, there is that spark you can find again. So, and partly this group is part of my spark. So,
Yes.
Yay.
Absolutely.
Love it, love it.
and who are you?
I am Pauline Shiver, owner of Elite Rehab Performance. I am a physical therapist and certified strength and conditioning specialist, and I have undergone extra training to become a certified cancer exercise specialist. So I have gone through quite a bit of coursework, but hands-on training, book training, just all kinds of stuff to help be able to
Hands on my training.
Yeah.
Hands on me.
be able to work knowledgeably with a population that has dealt with any type of cancer. So it's not just breast cancer, but particularly with the exercise portion of it, because there are some very specific things that you want to look out for when it comes to exercise, depending on the type of treatment you've had. And while I have not myself undergone any type of treatment or had a diagnosis of cancer, my grandmother passed away from colon cancer, and so that was an experience, like Kim said, kind of lived through a loved watched them go through that. And then I helped start a nonprofit that dealt with cancer rehab and was able to kind of walk side by side with individuals that were dealing with various cancer diagnoses. So I can bring
That's the thing that I think makes breast cancer unique, and take that for what it's worth. I mean, that's our topic for tonight. But I think it is a unique type of cancer to deal with and manage, because it hits all a lot of different age groups.
Yes.
A lot of cancers are age related, so you have a population of people that aren't used to moving and grooving and doing, and breast cancer can hit from 20s, but 30s, 40s, 50s, and it seems to be that those risk factors are getting to where more people are younger and younger with that diagnosis, which I think makes it a bigger and bigger issue, because you've got a lot of cancer treatments are really good these days. You got a lot of life to live after that diagnosis as well, which is just to say that's why I think it's more unique than
I would agree. I would agree, especially from some of what I learned in my training with other types of cancer, is that some of them are, easy is never the word, but a surgical removal can be much more effective.
Right.
And not have a need for radiation or chemotherapy, whereas breast cancer isn't always that cut and dry. And like you said, that's not the right words, but how to put it, I don't really know how to put it. But it's just, it's so multifactorial, and there can be so many different types, almost in stages and ways that it can evolve, that I think it's definitely a unique instance.
When I go, this is back to my cynical side, I don't know that there's any easy way to say that, but I will tell you that there is a pre-diagnosis personality and a post-diagnosis personality, and those two people are not the same.
So,
to the point of, and maybe you can touch on that, I had to grieve my previous self.
I was going to say, can you explain, like, what's the difference for you specifically, the pre and the post?
It's hard to put a finger on specifically, but I think I took my health for granted prior to that. At the time of my diagnosis, I was in the best health and the best shape I had been in. I had made a conscientious effort of eating what I consider, I mean, I'm educated, so eating the right things, exercising my body, moving myself. I had 3 younger kids at the time, so I was occupied and taking care of them, but I didn't have a lot of cares or stresses that were more than usual. And so I approached life with a little bit more carefree attitude. And that diagnosis, I likened it to being in one of those carnival games where the ducks go across the screen, and then you got to shoot the ducks down, and sometimes you don't get the ducks, and sometimes you get the duck. And I liken my diagnosis to being the duck, because it takes you out of, I mean, those ducks are swimming by happily, and then bam, you're down. And then you have to go, I put on well, crap, I gotta beat this thing, or I gotta deal with it. Like, I'm very much a problem solver, so okay, what are my options? What can I do? How can I get through this the best way? Which is where you came into, in part, for me. And you get through that, and that, for me, I was a little bit more complicated, because you never do anything easy, but I had a diagnosis and finished, I had 7-8 months for diagnosis, which is not the longest or not the shortest for a breast cancer diagnosis, but I had 7 to 8 months of treatment, which was head down, get the work done, do the best you can, make sure everyone around you is still happy as well, because I never stopped being a mother. And then it was, wow. Then I didn't know that person for a long time, the after diagnosis, after treatment, because all of my friends, most of my friends, were of the mind that, oh, you finished your treatment, you beat the cancer, there's no cancer around. But my inside self never, and to this day, I'm 6 years out, I don't feel like I'm cancer free. I feel like cancer's in my rear view mirror, but it's always has the potential of jumping up. And so that, my post-cancer person is a little bit more darker and cynical in not a humorous way, if that makes any sense.
Well, I like your duck metaphor, but this is my lens in the world I work. Tell me if it makes sense. So I look at a diagnosis, you're going along and life is lovely. You're young, you're in the prime of at least it seems in the experiences around me right now. Those that I know who've experienced breast cancer, it was like a critical incident. And I define a critical incident or a diagnosis treatment as something that happens to you that knocks you off your feet, that you didn't expect to happen, that fractures that sense of control, that sense of safety, that sense of predictability.
Mm-hmm.
And that stays with you even when you survive. That experience is stressful and traumatic and reframes your worldview about yourself, about your body, about others, and
because you never regain that total trust and control of your body again, because it screwed you once, it could do it again. I mean, to put it bluntly. But.
Right. So, maybe you never find any silver lining in that, or it looks different, and that would be okay. Does survival, does living through cancer, you get through it, but you're going to look at things differently.
Mm-hmm.
And isn't that okay?
Oh, yes.
And
I don't necessarily dislike the person I am now. It's just a very different person than I was before. I mean, I think there are a lot of good things. My perspective on healthcare, for one, has radically changed. There's not all one good way to do something.
right.
I think it gave birth, in certain respects, to the practice of wellness for women, to take a look at it, to take a look at problems, common problems, from a different lens, so to speak. So I don't dislike the person I am now. It's just a very different person, and it took me a good, probably 3 years to like myself again, because I kept looking for that person that was there before, the one that could have fun and not worry, and she wasn't there for a while.
Right. So the beauty of you is still in there, and what you've come out on the other side, whether it's growth or however you define it. You've translated it obviously into elite or wellness for women. And I think the same from my own experiences with acute stress or traumatic stress is you're never going to be the same before you're injured. But things that injure us, if we make it through, we all have the capacity to heal with the right ingredients. And I think that's what we're talking about today.
Well, and that's so it's you put your head down, you get what's done that needs to be done. And I mean, there are so many, because that diagnosis is so varied. What the right thing for you, treatment, whatnot. I encourage, ask as many questions as you need, research every avenue that you can to find what works for you. But that's not really up for discussion because it's so individualized. What is universal is once you're done with that treatment, putting the right support people into place and figuring out what that new version of you looks like. I choose to think that it's a newer, better version, slightly darker humor, but nevertheless.
But we like that.
We do. Yeah.
But it took mental health care, it took physical health care, I did, Lord God, acupuncture, yoga, travel.
Yeah, but all needed to be had, and like you were saying, you can't. The diagnosis and the treatment necessarily is so individualized that you can't. We would be here all night talking about the various ways that it can be handled, but the getting through the treatment and then the after can be really impactful. How you do that, and that was something that I learned through the rehab center, the nonprofit, was watching people at various stages of diagnosis and treatment and how they would come through, because exercise is such a big component of it, but you have to do it right. And it's not always...
like, exercise was key to me, and it was the one part of treatment that made me feel normal. I could get to the gym, and my friend Pauline
remember that day.
says, no, you can't run anymore. And I said...
Right then. Yeah. So I've known Maribeth for years, and I knew you before a diagnosis, and I would know you now, and I would say I'm closer to you now. But I've known you, so I didn't see such a huge change in you. You've always been an immensely strong woman to me, and just I've always admired you.
I can box that one too.
Strong in so many other ways too, but I've always admired you and watching you through that. But I remember I was starting my training, and I came back from the course, and it was one on chemotoxicity and how heart rate and just some of the damage that some of the treatments can cause in combination with exercise. And she was on the treadmill running, and I'm like, get on the treadmill now. And it was a funny little way to kind of introduce that topic of, like, yes, taking care of yourself is key, and Maribeth did such a good job of that, like you said, prior to and then through it, but also having to listen to your body, listen to some of the restrictions that you're on, and that can shift you. So when you're going from a very fit state to then being told, well, you can't run anymore, you can't do this, you need to be careful with this, your body's kind of rebelling against you, basically. And then you've got to shift all that. How do you get back? What do you do instead? And so it's nice to have that support network there that can kind of guide you through some of that, because it's not the case with everything. It's treatment dependent and chemo dependent, really, based on the type of chemo that you're getting and whether or not what symptoms you're going to have and how you have to monitor it, how much exercise you do. But then it's different for someone who's completely sedentary and then is going, well, now I need to take care of myself because I wasn't before, and what do I do? And so those are the pieces that don't, get talked about as much, I don't think, but
it's that one piece to your comment about the loss of control, the after trying to figure out what exercise and food routine, that was my way of trying to take back some control, because it was the one thing that you can concretely do that impacts the risk of recurrence.
And how you feel in the moment, because chemo doesn't make you feel great, radiation doesn't make you feel great, there's after effects that linger for so long afterward, and that stuff's not in the moment, it's not important. Like, that's not going to be talked about, because in the moment it's about, I want to get you well,
right?
And
what
do we need to do, what's your treatment? It's not the 15 years from now this could happen kind of thing. And that's more with the exercise related stuff that can happen later. We're finding out with just some of the neuropathies and things like that. The radiation fibrosis can continue years after. There's just certain things that can happen, and that's not the issue in the beginning. So that's that piece that needs to be, gives you that control back to go, okay, I've got through the treatment, and now what's my next step? How do I make myself feel the best that I can, where I'm at right now, meeting myself where I'm at, and then I'm going to grow with it.
And that may initially mean, even if I was doing 3 to 5 miles on the treadmill a couple times a week prior to the diagnosis, and then afterwards, when my treatment was completely done, a walk up and down the street once or twice a week was what I could do. And it's figuring out where you're starting and knowing that's not where you're going to end, but finding the people to put in place to figure out what's the next best step for you.
Can I ask a question? Just throwing in, you're talking about you're in the grind. I mean, you're type A, both of you are. You want to fix it.
We're diagnosing.
You want to solve. You have all this wisdom that before you get this diagnosis, and you want to fix your own business, which can be hard. Well, also, wouldn't it be normal that you're a mother, you want to be strong for other women, and then there's a lot of research about the power of positivity. But where in your treatment did you give yourself permission to not be okay? It's okay to have days or moments of fear. I can't do this anymore. And this is overwhelming, and I don't know how I'm going to get through this. Did you give yourself permission to do that?
Sort of.
Naming it to tame it.
I made the conscious decision to step back from work for a few months.
Okay.
And that was a big decision for me, but in doing that, it was my concession to the disease, and everything else paled in comparison. So I didn't, because I could put on whatever face I needed to put on during the day and not have to see patients on the day-to-day.
So I look at that as shifting your time and your energy to your health.
Right.
And not trying to do it all.
Right. And so I think that was the concession I made. I don't know that I ever said it was okay to not be okay. Because in my opinion, that was giving in to, I just got up every day and did the best I could. But taking one of those, all the many hats that I wore, mother, physician, wife, taking that one hat off allowed me to focus more on what was important. Did that answer?
But, you know, we all have to figure that out.
Yeah, because not everybody has the luxury of being able to step back for a few months.
And
but
then,
you gotta reprioritize. You gotta figure out what your priorities are, because you do not. I promise you, no one has the energy to continue your post-diagnosis life as you did your pre-diagnosis life, especially during treatment.
Right.
There's something that's got to give in there, and if you don't allow yourself that luxury to figure out where it fits in, you're going to be worse off. I think that's, for me, that's where the power of positivity came in.
yes.
It wasn't everything rosy, glory, sunshine and giggles every single day. But I still had some rose-colored glasses and giggles. I just delegated those a little bit more efficiently.
I'm figuring this out. I'm going to protect my resources for my family, for my health, for now, for this chapter of my life. And you don't have to do it all, or you don't do you need a space where it can be ugly, it can be messy, it can be imperfect. I just believe that's important.
Yeah.
Regardless of what you're going through. So you affirm that. Okay.
I know.
I know, this is a lot.
It's heavy. It's heavy, yeah.
Heavy.
But it's a conversation that should be had.
Well, one of our questions is, what's the first step you take after getting the news?
Take a beat.
Right.
Take a deep breath.
Yeah.
And then you start putting your people together that are going to get you where you need to be, because you can't do it alone.
Find your team.
Yeah.
But that could be
medical team, support team.
yeah.
Right.
The
Yeah,
basics.
just, friends, family, like there's people you
I
trust.
recommend a good friend who has inappropriate humor and a lot of memes at the ready.
There you go.
I was very
That's
blessed
always
with
good.
that. I had several, but one in particular. Yes, because laughter. I turned to laughter a lot, and probably very inappropriately. But
Why is it inappropriate? It got you through.
I lost my hair by Thanksgiving, and so I wore a bread cornucopia on my
But
head.
see, to me,
Sourdough?
I wasn't into sourdough
With
yet.
some honey butter.
But I think,
Yeah.
but that's,
See, inappropriate humor.
it's inappropriate. But
But a serious answer to your question is take a deep breath, know that you don't have to do this alone, and then start putting your team together however you view that. If you have a spouse or a partner, my kids were part of that team. I knew which ones I needed with me after chemo versus not.
Would you say that that's a good, because I would say that a piece would be also knowing who you have to protect your peace and your space, and not everyone is going to be who you need at that particular moment in time, and making sure you look out for you, and if there's a particular group of people or something,
And
that you can kind of
recognizing-
say, I don't need this right now, and you sort of distance yourself and
Well, and
surround yourself
recognizing
with
you
the
might
people
piss some
you need.
people off in the process
And being
if you are
okay.
in fact reserving your resources for what priorities you have figured out.
Is what
Yeah.
you're talking
But
about.
yeah, boundaries, just knowing who you
Keeping
need at that
your
moment, and then
limits
doing
small.
it for you, because it is hard to sometimes be like, this isn't the person I need in my space right now, because they're not going to give me what I need at this moment, but I can come back to that. And so I think you do have to start to figure out, like,
What I would
what
also,
do you need?
adding that part of that team, you need to have a what's the guy that stands at the door?
A bouncer.
Bouncer.
Yeah, yeah.
One of your team needs to be a bouncer, whether that's for me to a certain extent was my husband, or the inappropriately humorful friend. Like, you have to have someone that if you, on those days where you're not capable of saying, get out of my space, you have to have someone in place that is.
I think, because you're not going to have that capacity for that every day.
Mm-hmm.
And I would say then another piece is, like you were talking about earlier, is look at your options too. Like, put your team in place, but also know that there are maybe some options. Look at it, investigate as much as you can. In
Some of
cases,
those will
you can't.
naturally evolve too. Like I can recall a couple people that just pleasantly surprised me that filled that need I didn't even know I had at the right time, and then just as easily kind of floated back out.
And is it okay to ask, as a friend or a caregiver or a family member, to ask you what you need? You don't need explanations, you don't need whys, but maybe you just need love or something very practical.
Sometimes I just need a chocolate chip cookies.
That's very practical. I think that's
But recognize too that I didn't always know what I needed either. So if you don't get the right answer,
so. I show up until you say not now,
Right.
or I show up with the toilet.
which is more important for the surrounding people.
Okay.
Don't give up, kind of thing.
Right.
Yeah.
If you say not today,
That
show
means
up
not
again.
today, but tomorrow. Yeah.
Right.
So you put your team together, and then you put your head down and you do what you have to do, whatever treatment that is that you choose.
Good work.
You get
What
there.
about the people around you? Like, I think that cancer is one thing that like affects not only the person that has it, but everybody around them too. Like, how do you think that it affected your family, your kids?
If I'm being cynical, I probably would say that there are still yet to be results from that. Because breast cancer is one of the, I've got 2 daughters, so breast cancer is one of those things that, they're 18 to 25, it's not a concern now, but when they're 35 and 45, I don't know how that influenced them. I tried to make a conscious effort at checking in with them on a regular basis to see how they were doing. But I don't know, that's a very good question.
So the underlying fear of, will this happen to me again, or will this happen to my children? Or even women in your circle. Well, if it can happen to her, it could happen to me.
Yeah, it had a resounding effect with my sister, my mom. There's no cancer in a vacuum. Even if you have no friends or no nothing, that your diagnosis does not happen in a vacuum. It has resounding effects around you.
So all of us in this room are women or humans, so exposed to that vicarious pain and suffering that you went through. We're all vulnerable, and being able to find a place to talk about that even you who said from the beginning, I did all the right things, I believed, to take care of my body, my health, manage my stress, and still I got this diagnosis.
Cancer doesn't care.
That's right.
It doesn't care.
No, which is why, which is one way it has shifted or shadowed. I was always a proponent of self-breast exams, clinical breast exams, that kind of thing, but I do have a different response when people say, well, I don't have any of it in my family, I don't need to worry about it. I'm not quite as sweet as I used to be when I am faced with that response.
But I appreciate that. Honesty with that.
And I usually, I try to explain where I'm coming from with
Because
that.
you don't have to either.
Right.
Because you're just, you lived an experience
But
that
that's one way.
comes with some wisdom.
Well, and I would be negligent if I didn't pass along that wisdom. But,
Yes.
So
I
being
would-
informed or educating women that you don't just have to have a history. So
Yeah. Well, no, I was just gonna.
Only 10% of breast cancers are genetically linked. 10%.
Yeah, it's
And
not.
1 in 8 women will have breast cancer in their lifetime.
It's crazy.
There's
Those
we
are
almost
some
should be
crazy
talking about
numbers.
that.
Yeah, it's
You
just it's
not worrying about it, not perseverating about it.
no.
I
but
want to know
knowing
about it.
it's there and
But don't shove it under the
Yeah.
carpet,
yeah, don't ignore it.
because then you'll really trip. But
I was gonna just comment on that when you were saying family, and I can only say this from the perspective of having watched my grandmother go through it and my mom. Did your family have any of this? But sometimes, like in that case, putting the family member putting their wishes on the person that's dealing with it, and that was hard to watch. My mom was really trying to pressure my grandmother into certain treatments or ways to handle things, and I think that can be hard and difficult to navigate. Because as a family member, you care so much and you just really love that person, but knowing when you got to back off because it's not your choice.
that's part of putting your proper team together. And knowing
And the balance.
first string and second string, and everyone means well for you, but
Yeah. But
at
when
the
it's
end
a
of the
first
day,
string,
it's
it's hard. Because my mom was the one pressuring, and that was really tough. I watched my grandmother go make some difficult decisions, and that's a tough one. But I think that's a conversation that should be had, maybe with. And again, I haven't experienced it personally, but if that's an issue, having that, because I do wish I had been able to come in there and kind of help them have a conversation a better conversation than was had. But I don't know if that happened with you or anyone was sort of pressuring you away that you didn't necessarily want to go, or do a treatment you didn't want to do. But that's a reality that does happen, and knowing how to navigate that and who you can turn to really kind of help you not have to hold on to somebody else's issues when you're dealing with. Does that make sense?
If there is such a thing as a power couple in the cancer world, as an OBGYN married to a hemonc.
I mean, y'all are pretty good.
Yeah, there weren't very many people challenging how we proceed.
I mean, in the middle of
That's
that.
fair. That's fair.
Wow.
So no, I can't. I mean, yes, I absolutely see where you're coming from.
But no experience with that.
No
Okay.
personal
Makes
experience
sense.
with that.
Makes
No.
sense. Yeah. That was just our thing that I watched with my family, was watching, such a devastating thing happen, and then having people sort of fighting over what the person's wishes were and how they wanted to handle it, and that was tough. But I think there could have been a better conversation. So I think that's goes back to having the right team in place and knowing if you need to stop that conversation, doing so, because sometimes it's not healthy. It's not what you need at the moment.
No, it's all right time, right place, that kind of thing. Right.
Well, in a perfect world, whether it's breast cancer, or a serious illness, wouldn't it be lovely if we all had this discussion with our family members? What if your time became short? What are your priorities? What are your fears? What are your worries? What are you willing to sacrifice or not?
We definitely have more of those conversations now than we did before. But as far as open conversation throughout the whole thing, that was imperative to me. We didn't have very many secrets within the family because of those issues. I mean, I was making the decisions, but I wanted my kids, my parents, my siblings to know why those decisions were being made, that I wasn't just making them willy-nilly. Conversation was key.
Well, one of my favorite books is Atul Gawande's book, Being Mortal. And he asks those questions, we just don't have, I wish, in many of our family systems or even our friendship circles, that we had these hard conversations rather than the critical incident happens and you're not prepared.
Well, because you never know how much time you're given, whether it's cancer or a car accident. You don't know.
I sure would like that formula or that algorithm. I like my script. I like to know what I'm going to do.
I've taken the approach, because I know you don't know. I've learned that firsthand.
Right, you can't
I
control
take
it.
the approach, which sounds very cliche, but you live every day to the best of your ability.
Mm-hmm.
Some of those are good days, or some of those are not so good days, but you have to approach. It's a mindset of you don't know how much time you're given, so make the best of it, which then leads to good decisions about diet and exercise and travel and what makes me happy and what
Doing
makes
things you love.
yeah.
Well, and some days have fireworks, and some days are mundane or difficult or gloomy. And we're not promised fireworks every day.
Nope.
But
Perpetual Mondays.
I know.
Oh,
So let me jump, now that we're talking, let me jump to one of the questions we have here that's so much part of our world. Menopause and hormone health, what's the interaction with breast cancer treatment, recovery, all the things?
That's where you gotta have a good team in place.
You have a great team,
No.
yeah, because that's one of the kickers. Again, breast cancer's it's unique in that you could enter your diagnosis of breast cancer as a happy hormonal chick and leave your breast cancer diagnosis and treatment as a postmenopausal person.
At the
Dealing-
age of 38.
Yeah,
Young,
I mean,
young.
it doesn't. Well, so many factors go in,
Yeah.
but yes. So the hormonal component is massive on many levels. So you have the ways of managing menopause.
It can change.
The toolbox is smaller for menopausal management in a breast cancer patient, especially if their breast cancer was hormone dependent. Not all are, but if yours was an estrogen or progesterone positive, estrogen or progesterone receptor positive cancer, Lord have mercy.
I know there's a lot.
The toolbox for managing menopausal symptoms is smaller and shifts more to the importance of lifestyle choices and quality of life, like how you eat, how you exercise, how you sleep, all of those things.
how you manage your stress. Yes.
Yeah.
Because you don't have the traditional hormones. Not that hormones make it easy, but it is one concrete thing you can do that fixes a lot of issues. You don't have those at your ready. You have to be more creative, think outside the box. some chats with yourself about what you can tolerate, what you can't. A lot more talking, a lot more counseling that goes into that menopausal management. And then that's not even talking about like the younger women who are trying to preserve their fertility too.
Yeah.
There's a lot that goes into it.
Yeah.
The recurring theme is have a good team.
It really is. We've been having some good themes lately.
Connections.
I like things.
Yeah, I know you do. You always find one.
I do always win. Well, it is. I mean, you have a
Good
team for treatment. You have a team for support. Sometimes those are the same team.
Mhm.
You have a team for the aftercare. You played a vital role in that, and still do. I mean, I'm
Yeah,
forever
you just
enjoying things. Yeah.
Well, I want
Some of that's just,
the information. I want that to be accurate, and I know I need an accountability partner. So
thing. Yeah.
that needs to be part of my team. Okay, today you can be a sourpuss, but tomorrow we're going to Pauline's. We're working out.
Yeah, like you get a
But we're not
timeline.
running.
Yeah. Not in certain cases, no.
Menopausal bodies don't like running.
So, hey, I don't know. Mine misses it.
So let's talk about what it does to your body after the diagnosis and treatment and stuff. We have a lot of people who are coming in here for physical therapy for things that you would think are completely unconnected. But what does it do to your body?
So it definitely depends on the treatment, but it kind of
Makes you
radiation makes you chubby. I mean it.
It's almost everybody
I'm-
thinks you get cancer, you're going to be
Yeah.
skin and bones.
No,
Breast
no.
cancer makes you chubby.
It can and yeah.
Not even chubby.
Because there's yeah. But so depending on the type of chemotherapy and the treatment, but I can say certain classes of chemotherapy and a lot of times with breast cancer, particular ones are used that are considered cardiotoxic. So those are the ones that you can't run because you got to keep your heart rate at a certain level, and
You'll
that's
stress it too much.
Yes, and it's not because it's and this is where that gets tricky because you want to exercise because you really need to get through it because that's going to help you manage some of the other symptoms better and mental part of it. But you can't let your heart rate get too high because over time that will damage your heart because the drugs are damaging your heart. They're cardiotoxic, so they're going to cause damage, and you'll be scanned for it. But the problem with that is it doesn't happen in one big all of a sudden episode. It's not going to not be here on a echocardiogram, and then it is going to be on when you're done with chemo. It's incremental over time, and so it may not show up. They're finding that people are developing congestive heart failure 14 years later after treatment because they exercised too hard during chemo. But there's echoes.
Is that because there's too much of both of a
It's the
physical
combination,
strain
yes,
of exercise
yes.
and the
And it
chemical
damages,
strain
yes.
of the medicine?
So it adds up and it damages the heart. So then over time you develop
Yeah.
congestive heart failure, but you didn't catch it because they're usually doing those echoes at the start of treatment and then at the end of treatment to see what the chemo did.
Right.
But it's not going to pick up the stress that the exercise did necessarily. It develops later. So knowing which drugs you're on and having someone who's knowledgeable in that guide you in your exercise. So that's where when Maribeth was running, I'm like, no, that was a particular drug that was cardiotoxic. I needed her to keep her heart rate at a much lower level for that time period. But then
So
you
it's
can shift.
temporary.
Yeah, it's temporary. It's not forever. But it needed to be for a certain time period. And
Because
then
once you're done with your chemo, and then your
And
heart starts
yeah.
healing itself, then you only have the
Yeah.
stressor of
but
the
there's
physical activity.
but then there's phases that you want to ease back into. So it's not like you jump back into running 5 miles. I like to develop programs. I like systems and structure, and you develop a way to get back to that. So that's where the cardiotoxic. Now, some chemos are going to cause peripheral neuropathies, which you'll get numbness, tingling, pain, burning, weird sensations in your hands and feet. You can lose your fingernails, things like that. Those are not so easily treated, but exercise does play a big role in helping kind of mitigate some of that and minimize it. And that's a different class of drugs. So
You should start relying more on your
other
I think,
senses.
yeah. I was gonna say it's a balance issue
Yes.
at that point. If you can't trust your fingertips or your toes or your feet, you have to have a
Rely
stronger
on
core
something
to.
else. So definitely, so those are things to kind of think about. Radiation is a whole nother one. Not everyone gets radiation, and there's some other different classes of chemo that have some other effects. But yes, they're going to affect your body. They're going to
And some of those are
yeah.
temporary effects, and some
and
of those
some
are
are long
longer
lasting.
term. Yeah.
And then the radiation causes radiation fibrosis, which is tightening of the skin and the soft tissue.
Which is it not at all related to the 6 weeks that you have radiation?
No. A lot of times people don't even notice that until months, if not years later. So radiation fibrosis, you may not notice that at all when you're getting radiation because it tends to be pretty quick. But it'll start to develop weeks, and then you're getting tight and you can't move your arm as much. And then again, this can be 10 years later. Now you've got range of motion restrictions. And so it's managing that through it and staying mobile. And that's, again, needing that knowledge of how much can I push this, how much is damaging, because some people react differently to radiation with their skin, and that, there's radiation burns, some people don't. So it's knowing how to manage that. And then lymphedema is a cancer-related lymphedema. There's different kinds, but cancer-related lymphedema is a real thing too, and it has nothing to do with how many lymph nodes you have had involved in it. You can get lymphedema without having had a single lymph node touched, and lymphedema can develop years later. It has absolutely nothing to do. So there is a misconception that you only get lymphedema if you had lymph node biopsy or removed. That is not true.
Higher risk of it more immediately if you have lymph node
Can
disruption.
be, but not always.
Not always.
It's very much related to how you heal and the how your lymph system responds to that stress, and does it get backed up. So if you're have these lymph nodes removed, but you're doing the right amount of exercise, you're keeping your body loose, mobile, and you're keeping those highways open, is kind of how I was taught. It's like a highway, you're not going to get a traffic jam. And then you have to help support the other lymph system, because yes, we have big groupings. We have big groupings. Most people think of the lymph system like the axillary region, your armpit or your groin behind your knee, but there's a whole bigger system underneath all that. We've got lymph nodes along our spine. We've got them around our rib cage. Like, they're everywhere. And so one of the treatments that I was taught was how to facilitate some of the deeper lymph nodes to help now take off for the missing lymph nodes. So you redirect around. So those are just some of the things, but it's definitely dependent upon what, surgical complications arise too, if there's this type of surgery, and then reconstruction. There's a lot of stuff that can happen with that, but it's just, you need to have that team and those people knowledgeable about it, and particularly when it comes to exercise. It's not that easy to just go to someone and say, I want personal training because I want to get better. That person really does need to have some knowledge behind it.
So, I like a theme.
Mm-hmm.
I hear, when I talk about health and wellness, it's diet, exercise, that kind of thing. When I hear you talk about post-cancer treatment, it's about exercising and working with the right person and doing it in the right sequence.
Yes.
I'm throwing Kim under the bus
I'm
because
sitting here ruminating about how
I
this all
will
makes
say
sense.
that those are equally as important. The kicker with regards to cancer, and this could be during treatment or when you're trying to figure out what that post-diagnosis person looks like, is the mindset.
Yes.
Because you are not up for making great decisions. So how do you navigate that?
Well, and is it on throughout, but towards the end, how do I trust my body again? How do I love my body in its new state, regardless? How do I reconnect sort of somatically? Because you talk about some of the post-treatment symptoms. So having wise people that inform you and normalize some of these reactions that I had no clue about.
Yeah.
Where's the C, all of the above button? All of those things.
And I just look at, again, going back to a diagnosis and treatment of a significant medical condition, you need time to reset and recover and adjust to all of this, and giving yourself permission to have reactions that are normal.
So what resources are available for that? Because I know medicine was thrown at me, but not really a physician, not really a medicine kind of person.
That makes you
Well, and again, both of you are more connected to the cancer world than I am, but is it an individual level? Is it a small group? Is it a formal cancer group? And I'm imagining cancer centers or people that have been through this and have lived experience are going to give us a menu of options.
I would say my biggest struggle with that, because yes, all of those
Faith communities
play a role.
Even.
My biggest struggle was I was young enough to have kids and was working on a daily basis.
You have to
But
get
some
back in
of
the game.
those group, like there wasn't enough hours in the day to
Get
do
in
it
that
all.
time to grieve or readjust or
No,
redefine
or even to
yourself.
find that friend, that group of like-minded individuals.
Mhm.
Because if I could find one of those groups, they were kind of Eeyore-y. And I didn't want to surround myself with Eeyores.
Right.
I wanted other people who were in the mix with young kids and working and
Or maybe further down the road than you were.
yeah.
Not
I
in
didn't
the
take
same-
anyone.
Right. That maybe were 5 years out or 10
Yeah.
years out and had more lived experience on the other side. I mean, I don't know.
That would be a fantastic thing to put together.
So is there somebody that helps you that says, hey, you got your treatment here, but you also need to talk to a physical therapist. You also should find a support group. Is there somebody that does that?
There are loosely.
Teams.
Loosely.
There's a
Care
nurse
managers.
navigator that sits down with you and gives you all of the options. My take home from that was I could do pottery once a month.
And that would be enough wellness.
And that was enough wellness for me. Like they were talking about losing hair, and I'm like, go back to the pottery part. Yes. Do I think it's done well enough in our current community? No. I don't know where it's done really well unless you have a place that has the funding and the setup to have what's a comprehensive cancer care center. The problem is in the smaller communities like ours, the doctors and the nurses are concentrated on one thing, which is to get rid of the bastard cancer.
Right.
There's not a lot of other accessory personnel to do those other things.
I mean, I'm just thinking that there's probably not a lot of people out there that know to stop you from running when you're on this kind of chemo.
I would say in our area, no. Now, where I got trained is in Colorado, and they have they're set up very much like you're talking about, where they have it's physical therapists, occupational therapists, personal trainers that are specifically trained from college that do internships there, exercise physics. It's the doctors, like they have this amazing network where it's you get diagnosed, you're going here, and it's bam, bam, bam. You get all this testing.
Duke Integrated Medicine, Duke something.
I think
has
it's
a
something
place there.
similar.
Yeah.
I don't think it's quite as good as the one in Colorado, but I was also taught too, and I would say that's very true here, is that the doctors, that when you're getting your diagnosis, their goal is to save your life, and that is it. They do not necessarily spend any time knowing about the rest because it's not their concern. Our job, and that was speaking to us as physical therapists, was we're then the ones that help dictate the rest. And so I think it's just kind of knowing that there's a person somewhere trying to know. And so when I was a little bit more involved when I was involved with a nonprofit, which I'm not anymore, I very much was in the hospital talking to people and trying to say, hey, we're here and here's the resources and stuff. But no, it's very loose. And again, the navigators too, it shifts, it changes. If you as the professional aren't advocating for yourself and telling them, it's not easy for them to go out and find it. So, it's not always their fault that they don't know. Sometimes,
Well, then
they
there's
don't,
always that big
and-
elephant in the room of who pays for that stuff too.
yes. And also who's checking these credentials and stuff, because you can say you're anything, but are you really? And I say that as a cautionary thing for people, because I've been in the personal training industry longer than I've been a physical therapist, and I've seen plenty of people say they specialize in this care or they specialize in this care. And I'm sorry, but personal trainers, it's not licensed. It is a certification you can get overnight. You can say whatever you want. So you
Comes
just
with a Lululemon discount,
yeah,
too.
it does. It's a good discount. But you have to be careful, because if you're just and not putting down personal trainers in any way, shape, or form, but it's just you need to know who you're going to, because there are certain things that they're not regulated. When you're licensed as a physician or a physical therapist or clinical social worker, you're licensed. Like we have to uphold
We're held to standards.
Yeah, we are held to standards, and we have guidelines, and if we break them, we lose our license. But that's not the case with personal trainers. So just knowing kind of the difference and where you're going with that stuff, and so it's hard to get those pieces together. And in small communities, it's really hard, because
There's a challenge in small communities.
there's not the funding for it. There's not the resources for it. I mean, I think we used to have here, and this was before I even lived here, but I heard that there was a place where you could get bras.
There was.
for after you've had a mastectomy and stuff, but it's not there anymore.
Yeah.
There's no place around here to get wigs. I
Yeah.
think there's a closet in the hospital where you can go pick up.
My old one's there.
Right? That's it. And those things are devastating. So would it be great to have that where you can come and get fitted for a wig? That's like you get to pick from. It would be great. We just don't have the resources for that.
Well, and what I like about our group, tell me if I'm right or wrong, is we're very quick to say what we can do, and that's not something I can do, and let me help you find somebody who can. And
Do my best.
And that you don't do this with just one team member. That there's someone that reminds you to move. There's someone that gives you information about hormones and gut health and poop.
Yeah.
And then there's one woman in this room that is very passionate about stress, and that we all manage that differently. And that we can have these conversations informally and formally, and even in front of a live audience, which makes me very nervous. But
You're doing great, Kim.
but that we're not alone, and that we can worry about life, but not all the time. We don't have permission to do that. We're supposed to live in the present moment and find purpose and meaning and joy. And
Well, if you find yourself worrying about every moment, then that's probably a reason to reach out and get some help, because that's not the way we're designed to.
right, and so that healing is not just a medical plan. That there's a Pauline on the team or someone that you are willing to be real with and talk about what you're scared of, what was traumatic, and what the other side of this is going to look like.
Well, and it's not linear, however you
Yeah.
get linear. It's because you're gonna have, yes, it's all
Also
over the
this.
place because, and I mean, I feel like you've even said that today. It's just like there's steps forward and steps back, and then, you know, kind of finding that you again is gonna be different. There'll be days where you've got to be able to, you know, have a bad day and stay in your bed all day, and then the next day get up and have that person that's sort of motivating you.
I don't recommend staying in the bed all day, because then your hips start to hurt.
But
You
it's,
try that?
I tried that once.
I don't know. I like it, but it's in allowing yourself to know that it's not going to look the same for you as it does. Because I think there's comparison sometimes too, and I should be over it by this amount of time. That's not true. Everyone's going to grieve differently. Everyone's going to heal differently.
Well,
Everyone's
that's
gonna
why I
react
look at
differently.
it as a grief process, the whole stages
Well,
of
it kind
such.
of is. I
And
mean,
you go forward, you go back, you go forward, but it's a general forward motion, and you have to, and the best I can describe is you grieve the person you were. And that's not necessarily good, bad, or otherwise, but it is very necessary.
and then learn to love the person you become.
Right. And if you're stuck, we won't let you stay there.
Yes, yes. Don't and when you notice that you're stuck, reach out for help, because
And whether we are those people or
just somebody.
Right.
Yeah, it could be
We'll
your
help you
best
find
friend
them.
that's going to help you figure out why you're stuck. But knowing that it's okay to have the back and forth, but when you feel like you just keep taking those steps back, it's probably time to reach out and noticing those things. But I think sometimes we want this quick pat answer of in this amount of time you're going to be feeling X way, and then you're going to be back to this, and it's just not the case. And some people are going to it's just going to be different for every person. And-
Well,
and-
let's all collectively, like, rapid fire. We got
Okay.
5 minutes left.
Okay.
Let's rapid fire. What is outside of your person that is going to cure your cancer, or fix your cancer, or whatever? Outside of that person, who do people have to be on the lookout for?
What?
Who else do you have to bring into your circle?
Oh.
besides,
Like a physical therapist.
Okay.
Besides your doctor.
Okay, so besides your cancer doctor,
Yep,
Someone should talk to you about nutrition.
that's a good one.
yes,
And
That's massively important during and after.
because
That's a good one.
Yeah.
different. Yeah,
I know I need hope and courage and a horizon. So, again, faith, whatever that means for you. Something that is bigger than yourself, that gives you hope, opportunity, optimism that you're going to get through this. And that looks different for everybody.
It does.
So that guide or that light on your team.
I would say the person, and this is coming from someone who does not ask for help, rarely at all, is who's that person that you do feel comfortable enough to ask for help when you need it, because it's not going to be everybody, and you're not going to want to. But who can you trust and let down your guard, and when you're having that bad day and can't get out of bed, that you can call and say, hey, I need you, even if it's just send a meme, but just that person, like, so it's not medical related, but who's that person for you?
Hairdresser.
Yes.
Ooh,
Are there
yes.
That's a good one,
hairdressers that
yes.
specialize?
There probably are. I just have a good rapport with your own hairdresser.
Okay. Good idea.
That's
I got a
Good one.
huge shortcut before my hair fell out, and then back to my inappropriately humorful thing. She shaved a middle finger into the back of my head.
I don't remember that.
There weren't very many pictures taken.
I was just saying, we're going to need a photo, but
Yeah.
There are photos available.
I
of
wanna
that.
see
Not
that.
why
okay, that is a good idea.
That is
But
good.
having to, because to
That's good.
one of the big things I remember is looking into the mirror and not seeing me. So my hairdresser helped me with that moving forward. I mean, there's nothing you're going to do when you start looking at yourself bald, but that she helped to make that a little bit, that conversion to losing all my hair gentler. And then as it grew back, she stopped me from dyeing it all red. So she helped me make some
Okay.
decisions there
So
too.
you do a tattoo. I'm not really sure what I would do.
Oh,
Yours-
yeah. So
yours
I would
be
be
a
like, I'm your tattoo artist on hand. Because I would get tattoos. Because I love
That is a great idea.
I would be, but
Tell
one,
your story.
and I will say, tattoo artist. So this is a real thing. My tattoo artist does on reconstructions. He does the nipple tattoos.
Does he do the 3D?
I don't know if he does a 3D, but I think he might. But
That's a work of art.
there are tattoo artists that can. They are amazing. But when I joke and say like a tattoo just in general, but if to make yourself feel like a woman again, or if you
Yeah.
have that, or just get that piece back, there are tattoo artists out there that do amazing
Oh,
jobs.
yes, absolutely.
So that would be one I would have in my back pocket for multiple reasons.
That's a good one. Not people wouldn't normally think of.
You don't think about it,
automatically.
but they specifically will train
Right.
in a certain type, and then they also have to know with the skin, because it's not normal skin usually afterward. So they have to have special tools and stuff. So needles and things like that. So making sure you get the right one. But they are out there and they're amazing.
Well, that does not surprise me coming out of you.
I'm sure she has some names for you.
I do. I
That's
do.
really-
My nipples are just fine.
Okay, well, you know, I do have that.
We made it almost safe.
Still good.
Any last? You said rapid fire. Any other questions before we close out?
I don't know. I'm trying to think of anything else outside of the box.
That's a good question.
Well, again, theme. That's the thing. There's no inside the box or outside the box. Honestly, because it's a very unique disease in that it affects lots of age groups. It affects lots of people of different shapes, sizes, physical levels. So there's really no in the box or out of the box. It's more of a big bag of tricks.
We know. Yeah.
Mhm.
Be patient. I mean, ultimately,
Oh,
just patience is hard for all of us, but being patient with
With yourself.
which is how it unfolds, because you can't. Every time you plan for something else is going to happen. And then
I will make a
it's
plug
grace.
for prevention.
I
Live
mean,
in the
yes.
present
Yes, I
moment.
think we have
Yes.
to end with that.
Yes, we will end with the positive. So
Yeah.
prevention, so you never have to deal with any of that bag of mixed
Yes.
tricks. Prevention, eating well, taking care of yourself, preventative health care, because short of prevention, early diagnosis and early detection is the best way to have a full cure, which means, there's a lot of controversy. Gold standard is still a yearly mammogram, self-breast exam if you're comfortable with that. I talk to my 18-year-olds about self-breast exams, because not that I think they're going to get a breast cancer, but if they know what their breast tissue feels at 18, 19, 20, by the time they're in their 30s or 40s and something changes, they're gonna have a sounds so horrible, a relationship with, they're going to know what they feel like.
Your body.
They're
Which
going to
is
be able to
important.
pick up something.
If you don't know, you won't know what's abnormal.
I mean, I don't want to put anybody on the spot, but how do most women find it? Is it self-exam or is it a mammogram?
I mean, it's
I'd
a
love
little
to tell
bit.
you that I do that statistic, but I don't.
I mean,
Some people pick it up on their own. So they'll find that's usually, to the untrained person, that's usually not necessarily an early detection, because it's a big enough mass to feel.
Yeah.
Screening mammograms are helpful because they'll pick up something small.
yeah, I don't know the statistic.
Yeah, I don't know. It's probably pretty evenly based. We can also talk about the other I said gold standard is mammogram, and it is. Women with denser breasts, ultrasound can be a very useful mode. I don't like ultrasound as a standalone. I like ultrasound with mammogram because both of them bring something to the table. And then thermography. I don't know if anyone's heard of thermography, where they use a heat sensor.
That's cool.
It is cool, and it shows a lot of promise. It's not quite there yet because we don't know decisively how to interpret them. But if you have a trend, then they're helpful.
Yeah.
And that's not just for breast cancer.
Thermography?
Yeah.
I don't know. That's a good
I don't
question.
think it is.
I don't think. Yeah.
I know that I have lots of people who try to talk me into that as a replacement for mammograms, and I do. I'm rigid about few things, but that's one thing I am rigid about. I think it's an okay alternative, but it's not. It doesn't take the place of mammogram. And breast MRIs are an option too if you have dispensable income, because insurance doesn't like to pay for those, but they will pick up everything.
I would, and kind of in the same vein, but we're talking about such a heavy subject, but it's also not forgetting to live life too and not worry about it all the time.
Oh, because worry is a risk factor for
It can
developing
be,
cancer.
and so I think one of the most impactful things that I have gotten in my training about cancer is there's this portion of genetics and there's these certain things, and it loads the gun. Your lifestyle is what's going to end up pulling the trigger.
Yep.
And it takes multiple things to affect your DNA to create cancer.
Yeah, there's not one thing that causes a cancer.
You live your life the best you can with these things in mind, and take care of yourself the best you can, but also enjoy it. And not saying like push any of this aside, but like just knowing that there are some things that you can control them. Your food, your sleep, your stress, your exercise, and then the rest, you kind of have to leave it in God's hands. And so I think I would say just, be aware, know what to look for, know the signs, get tested, take care of yourself, and then live life.
Come line dance with us.
I mean, that wasn't like,
gosh,
we didn't plan that, but that's the best wrap up.
Oh, well,
Good job, Pauline.
every once in a while I come through.
That was good.
Unless anybody else has anything.
Any
What's
other closing
next?
thoughts?
What are we talking about next?
We never really let them know.
Oh,
It's always a secret.
TV.
But
Sometimes it's even a secret until right before.
Yeah,
Can't
sometimes.
wait. That'll really stress me out.
But we will
I'll
be back
here.
next month, whether you like it or
Yeah.
not. We hope you like it, because we like it. We will be back next month, and if you have any questions or anything else, feel free to reach out to us. You can get us at info@eliterehabandperformance.com or
wellnessforwomenpllc.com.
or
Kim Morris on Psychology Today, and if I'm not what you need, I will help you find what you need. Love and blessings.
sorry. And then we will put this up on the Elite Rehab YouTube page, which I will get that done hopefully by tomorrow. And I think that's it, guys.
Thank you all for sharing some time.
Thank you.
Bye.
Bye.